but time will tell on that. This is what the map looks like. If you've been following along, it's notable for some clearing in Missouri, particularly the central and southwest part of the state, down through the Ozarks, where the wave of Delta is receding somewhat. We'll also see some clearing in the southeastern U.S., but moving northward into Tennessee, which is currently the hardest hit state in the country, as well as Kentucky, Indiana, Ohio. A lot of intense activity. There's also a lot of activity out west, particularly in the Pacific Northwest, which has seen its own surge of Delta. What happens in the coming weeks in the upper Midwest and New England will say a lot about how this current wave plays out. Importantly, Missouri is in something of a stable stage right now with levels that have plateaued, although there are some clouds on the horizon with back to school that we'll talk about in a moment. This is the epidemic curve for the St. Louis region. Again, each green bar is the number of cases that were reported on that day. It's spiky like that because not every jurisdiction reports every day. And so we pay attention to that 7-day rolling average. That's the blue line. And you can see at the far right that we had an initial increase that I'll show you in comparison to Southwest Missouri in a minute. And then we flattened out where we've been in more or less a holding pattern for the last few weeks. In the last couple of days, there has been some increase in case rates in the region, dominantly in younger age groups. A number of the municipalities are reporting that up to a third of their cases are in individuals who are under 19 years of age. So that is a shift in what we've been seeing, and time will tell about how quickly or how significantly that might spread to older age populations that are at higher risk. This is once again our comparison between the St. Louis region, which is in orange, and Southwest Missouri, where Delta really took off in Missouri and actually for the country. That's in blue. Once again, our rise started about 6 weeks after Southwest Missouri, but we leveled off sooner and at a lower level. So on a population adjusted basis, our peak was just about half of what was seen in Southwest Missouri. The reasons for that are not completely clear, but probably relate mostly to actions we took to curtail personal interactions and start wearing more masks. This is our week-over-week change in the 14-day rolling average. We're up about 2% after several weeks of having numbers that were actually below zero, where we were contracting. However, our RE, our reproduction factor, is just a tad below 1. So as long as we stay below 1, that means the absolute number of cases will decrease. I think we're going to see whether the recent increases in younger age groups counter that trend and push us back up above 1, but we'll know that within the next week or two. Our hospitalization admission rates have dropped some. Again, the new daily rate of 44 was the lowest we've had in some time, and that's put our 7-day moving average down to 66. The hospitalization admission rate does tend to lag behind case rates in the region. So we'll have to see over the next 10 days whether the downward trend here is reversed by the upsurge in younger age populations. And at the same time, our census in the hospitals is now down below, well below 500. The daily hospitalizations of 453 is the lowest we've seen for some time, and our 7-day moving average is down to 486. Again, both good signs that the number of patients who are hospitalized has eased up somewhat. These are the numbers for today: 453 in hospital, 120 in ICU, and 83 on ventilators. So a fairly high proportion of our ICU patients are on ventilators. Again, that's a somewhat distressing sign, since we know that many people who wind up on a ventilator may not have a good outcome. Our mortality rate has been relatively steady. It's been somewhere between 8 and 10 patients a day for most of the last month. That moving average has not been varying very much. We only had 6 new deaths yesterday, but again, we'll keep an eye on that as the curve progresses. The question always comes up about vaccination and how well it prevents hospitalizations. Our most recent data shows that about 80% of hospitalized patients have not been vaccinated, so 4 out of 5. The number is even a little bit higher in ICUs, although those data aren't shown here. So there's no question that vaccination is the most important and most potent thing we can do to prevent people from being hospitalized. Among those 20%, that 1 out of 5 who are vaccinated who wind up in the hospital, the majority of them have either an illness that puts them at risk or they're in older age groups that put them at risk. So a young, healthy person who has been vaccinated has very low likelihood of needing hospitalization or becoming severely ill. We've been tracking the pediatric numbers. Today we had 19 patients in our 2 pediatric hospitals in the region, 6 of whom were in ICU. Again, pay particular attention to the 9 cases who are under the age of 12, and recall that they can't get vaccinated, so their only protection are the adults around them who choose to get vaccinated and to take appropriate precautions with masking and distancing. These numbers summarize our numbers to date. We had 87 discharges yesterday from task force hospitals. We're at 27,400 plus cumulative discharges. A lot of cases that have made their way through our health systems. In terms of projecting ahead, once again, this shows the mathematical models. We use the black dots, that's the number of people in hospital each day, to estimate where we're going to be. And the blue lines are what the models tell us about future census. And it's apparent at the far right that the numbers are actually falling a bit below the blue lines, which is good news and means that the number of hospitalizations is actually a little bit under what was predicted. Again, the caution here is we are seeing an upsurge in younger age groups. We don't expect them to inflate the hospitalization rate significantly, but we do know that one of the features of Delta is that younger age groups are very effective at transmitting the disease, and that can go to adults who are at higher risk, and so we'll have to keep an eye on this. Here's a very similar picture for ICU care, once again with numbers that are a bit below our model projections. Vaccinations remain our best tool for trying to keep COVID at bay and get us out of this current state where we have still a lot of disease circulating in the community. Nationally, nearly 2/3 of citizens have initiated a vaccine sequence. Missouri and the St. Louis area are behind those totals. So just over 50% of people in the St. Louis metropolitan area have initiated a vaccine sequence. Under 50%, around 47% or so, have completed a vaccine series. We really need these numbers to be higher if we're going to get to a point where we're less vulnerable to surges. For those of you who are interested, you can visit the PTF website and look at the individual rates for the counties that comprise the region. Again, we have several counties where initiation of vaccinations have exceeded 50%. That's St. Louis County and St. Charles County on the Missouri side, and Monroe County on the east side, and many more that are pushing their way up into the 40% range. But again, we need numbers significantly higher than this to protect us from future spread. So with those numbers, we'll move on to the questions for today. So first of all, the question has come up a lot about who needs to be tested. And I think right now, while we're trying to contain spread, people should err on the side of being tested. Anyone with new symptoms, even if they feel like they might just be allergies or a scratchy throat or maybe someone thinks they just have a regular cold. It's strongly advisable that those individuals go get tested. If they don't have COVID, then they can breathe a sigh of relief and not worry about it. But if they do have COVID, then they can take steps to protect others from catching it from them. As to where you can go to get tested, I'm sorry, there is one other group that needs to be tested, and those are individuals who've been exposed to a known COVID case. And testing 3 to 5 days out can help determine whether they've caught COVID and may shorten the duration of their quarantine. So screening testing for those who've been exposed but aren't ill is also important. In terms of where you can get tested, there are many locations. Several of the county health departments offer testing that's free of charge and readily available. There are also providers, urgent care clinics of various types that are able to do testing. Often those locations will charge for testing though, so be aware of that. And urgent care clinics and the like often need to do an evaluation, which may take more time than just going to a straight up testing center. A number of the pharmacy chains offer testing. And then finally, of course, hospitals do offer testing, but I want to encourage everyone to avoid an emergency room for routine testing. If you're not significantly ill, or if you're asymptomatic and you just need a test for clearance, it's better not to go to the emergency room. Anyone who arrives at an emergency room must be checked in. There are fees associated with being seen in the emergency room. And because emergency rooms must take care of the sickest patients first, visits for people without symptoms or with minor symptoms can be exceedingly long. So if you just need a test for asymptomatic screening or you just have the sniffles, please stay away from the hospital emergency rooms. They're not the best place for that to be taken care of. The next question concerns whether schools should mandate masking. I just want to be very clear about this. What we need is for schools to be able to take appropriate precautions to protect their pupils, both so that they don't get ill, so that they don't spread it to their classmates and the staff of the schools, and beyond that to the people in the community, including individuals who are likely to be much more vulnerable to severe disease. So with that said, whether that requires a mandate or not depends on individual behaviors of citizens of our regions. We need parents to take responsibility for their kids, both to protect them and to prevent spread to others. It's an important issue, and one of the best things adults can do is get vaccinated so they decrease the risk that they can pass it on to their children. Particularly kids who are under 12, they don't have much to protect them. So precautionary measures in school and being around adults who have taken the appropriate step of getting vaccinated. The next question is, why are so many vaccinated people getting COVID? Well, as the proportion of people in the population goes up, we'll see more breakthrough cases. But the current estimates are you're still 5 times as likely to catch COVID if you are unvaccinated versus being vaccinated. So it tremendously reduces the chance, although it doesn't eliminate it. Again, remember that these vaccines were not designed to prevent all infections. They were designed to prevent severe disease, hospitalization, and death, which they're doing very well. So we are going to see breakthrough cases, but it's still true that they're generally mild and they're much less frequent. The next question is, why do I still need a flu shot if I received a COVID vaccine? The simple answer to that is yes, if you want to be protected from influenza. Influenza and COVID are 2 different viruses. They don't share the same protein structure, and so getting a vaccine for one doesn't protect you significantly from the other. There has been some recent information about flu shot providing some supplemental protection. That's not something we would recommend relying on, and so if you have not gotten a flu shot, be ready to get one as they start to become available and flu starts to become on the scene. By the way, there doesn't need to be any time between getting a flu shot and a COVID vaccine. They can actually be given during the same setting. So don't feel like you have to put a gap in there if you are not done with your COVID vaccine or if your flu shot comes up sooner. The final question is, who should get monoclonal antibody infusions and where should they get them? This is just a reminder that the one therapy that we are most secure in knowing in terms of heading off severe COVID disease once someone's infected is the monoclonal antibody. These are drugs that do the same kind of thing that your own immune system would do in terms of antibodies that attach the virus and help the body eliminate it. They've been shown in multiple studies to decrease the risk of severe disease, of hospitalization, and death. So monoclonal antibody infusions are definitely something that people should keep in mind. They're indicated for individuals who are at risk for progression of disease, so anyone with an underlying illness that might put them at risk or in an older age group. And they are now appropriate for individuals at high risk who are exposed to someone who has had COVID. So both of those indications are appropriate. Any licensed physician in the region can order monoclonal antibodies. So if you believe you might be a candidate, if you're diagnosed with COVID or you've been exposed to someone with COVID and you are in a risk group, please contact your physician so they can help you set up an infusion. Right now, we're doing between 300 and 400 infusions a week in the region, and we'd like to see that number increase to help head off hospitalizations. I see that I skipped one question, which is why are we seeing so many more kids with COVID? And that really goes back to three things. So first of all, COVID, the Delta variant of COVID is much more contagious than its predecessors. It's much easier to catch, and we've seen it spread among kids much more readily than the Alpha variant or other variants of COVID. So that's the first thing. The second thing is to remember that anyone who is under the age of 12 can't be vaccinated. And even in the 12 to 19 age group, we really have much lower vaccination rates than we do in other parts of the population. So the virus is going to show up in groups that haven't been vaccinated much more readily than others. So we have a highly contagious virus, and we have a large group of unvaccinated individuals. And third, kids are back in school, and many schools have not taken the same precautions to preventing spread. So in schools where masking is optional or social distancing is not being readily enforced, that really puts kids in harm's way. So those three things together, a contagious virus, lack of vaccination, and being in close contact with lots of other people, lots of other kids, really explain why we're seeing so many children with COVID right now. Whether it causes a more severe illness in kids isn't completely clear, although I would say the clinical impression is that the children we are seeing now do have a bit tougher time with the Delta variant than predecessors. They're still, if they are otherwise healthy, at pretty low risk for serious disease. So that concludes my comments for today. Thank you for watching this broadcast, and we'll be on again next week.